Hi, I'm Dr. NGYN, and I have a clinic in Portland, Oregon, and I'm going to talk about heavy periods and endometrial ablation. There's a procedure we're now doing in the office to treat women with an outpatient one-day procedure where periods that are very, very heavy and disabling can be treated in an office setting. It's called endometrial ablation because it actually ablates or burns or cauterizes the lining of the uterus, which is the cause of heavy periods. This model depicts a side view of the female pelvis, and the uterus is the pink area, and that dark pink lining is the lining that builds and sheds every month when you have a period. Very heavy periods lead to a very thick buildup of the lining, much like a shag carpet, and it sheds. And many times women describe clots the size of plums or golf balls. They're very heavy and large, and they want to do something about it. Once we've done appropriate screening to find out you're a good candidate and that you're not planning to have children anymore, I, in the office, am able to pass a camera to look into the lining of the uterus to make sure you're a good candidate. This is called a hysteroscope, or a camera to view the lining of the uterus. It is done with a mild sedation. You're awake, but you're not fully aware of what's going on. We look into the lining, then take the camera out, and then I pass a balloon through the cervix, fill it with warm water, and for 8 minutes we cauterize the lining of the uterus. And you go home that day and rest, and the next day you're back at work. And 85% of women have either no periods or panty liner periods following the procedure. It is well reimbursed by insurance companies if you're the right candidate and it works for you. Usually women are delighted. They skip out of here 2 weeks after their procedure because they're so happy that they can now travel and have vacations and not be limited by their heavy menstrual flow. So talk to your provider about endometrial ablation. There are other methods, both freezing, NovaSure. We happen to do the Gynecare thermal balloon ablation, but we'd be happy to talk to you about it.